Hello, this is Professor Marvel. This is our week 2 content review. Hope everybody's having a good week so far. I'm going to share my screen and we'll go through the chapters. We'll be covering chapters 20, 21, 22, and 31 today. So the first chapter we're going to cover is, we're going to cover family development and family nursing assessment in genomics. Okay, so as we do with all the chapters, I'd like for you to take a look at the objectives. That is our goal for going through the information with regards to each chapter. So at the end of each chapter, you should be able to do the following 5. Explain the multiple ways public health nurses work with families and communities, identify challenges to working with family in the community, describe family function and structure, describe family demographic trends and demographic changes that affect the health of families, and then work with families using strength-based approach to assess, develop, and evaluate family action plans. So I've highlighted in yellow throughout the chapter the important areas that we need to be familiar with in order to support us being able to articulate the objectives. Okay, we know with regards to family nursing, we know that family nursing is practiced in all settings, right? We know that there's certainly been a trend over the years from moving health from the hospital to moving it into the community. Okay, so family nursing is a very important part of community nursing. Okay. Family nursing also consists of nurses and families working collaboratively with other members of the health profession, educational, social services to ensure success of the family, right? Families need support on how they respond to illness. How do they adapt to responses when there's an illness in the family? Okay, there's many challenges that exist with family nursing, right? The first starts with what is the definition of a family? We know that the definition of the family has changed over time. We know there's single parent families, same gender families, two parents of different gender families, multi-generational families living together, grandparents raising kids. Okay, so right now there really is no single agreed upon definition of a family. We do know that in family nursing, nurses are responsible for helping families promote their health, meeting the family needs, coping with the health problems within the context of the existing family structure and community resources. And then we also collaborate with families to develop interventions. Remember, we're taking our nursing process, our ADPI, and now applying it to the community setting, which we discussed in week 1. One of the important things we need to know is what's the difference between a family functions, and family structure. Okay. There are some common family structures that are applicable to all families. Okay, families have performed within these 5 functions. Okay, so and I've highlighted them for you. Economic function, reproductive function, socialization function, affective function, and healthcare function. And you can read about each of these. Okay, it is essential to understand these 5 family functions to understand how the family functions with regards to health, illness, well-being. Okay, and then family structure, okay, refers to the characteristics of the family. Who makes up the family? So what is your role in the family? For example, are you the mother? Are you the father? Are you the son? Are you the daughter? And then here in box 20.1, they give some examples of different kind of family and household structures. Okay. My screen looks like it's frozen, so I just want to make sure that this is recording. Okay, that should be good. Okay. So one of the things we look at in family health is what are the characteristics of healthy families? Okay. And this is in box 20.2. Okay. So it's imperative that we use terms like family health, family functioning, healthy families. Um, it really describes kind of the state of well-being of the family. Okay. Um, so have a look at box 20.2. It talks about characteristics of a healthy family. What does that look like? Family tends to communicate well and listen to all the members. They affirm support for all its members. They have a trust for each other. They play together. Humor is present. Okay, so have a look at that because you will be asked about that of what constitutes a healthy family. What are the characteristics? All right, we know that families with strengths, functional families, and resilient families oftentimes are referred to as healthy families. Okay, please review your levels of prevention box. Let's actually go through it in this particular chapter. So, what are levels of prevention? Remember, primary is your prevention, secondary is your screening, and tertiary is your treating. Okay, so look at these different levels of prevention, apply that to each of the levels. Okay, there's a couple of different approaches to family nursing. Um, First is the family. We could be looking at the family as a context or structure in which the family has a traditional focus that places individuals first and the family second. Family is a client, meaning the family is the primary focus. Okay, the individual members are second. Family is a system. Okay, the focus on this approach is the family as a client. The family is viewed as an interacting system in which the whole is bigger than the sum of the parts. Okay, and then family is a component of society. How do families engage in society, right? With regards to health and education, religion, financial institutions. Okay, so I'm skipping through quite a bit, but I'm trying to identify the areas in which we need the information to understand the concepts. Okay. Okay. Um, we obviously in family nursing are working with families for healthy outcomes. Okay. So how does that look? Okay. First, think of your ADPI here. First, pre-encounter data collection. What does that look like? Determining where to meet the family, making an appointment with the family, planning for personal safety. I have this highlighted because this is really important to know. If you're out in the community and working with families, you need to have your personal safety as a top priority. And here's a list of 12 suggestions of things you need to do as you're planning for personal safety. Okay. Then we go into interviewing the family, trying to define the problem. Um, Interventions based on your assessment, developing interventions. And again, we're going through the ADPI here. Okay. And then evaluating your plan. Okay. Healthy People 2030 in this chapter is specific to families and family nursing. Okay, they have three objectives. Increase the proportion of adolescents who have an adult they can talk to about problems. Increase the proportion of children who receive developmental screening. Increase the proportion of women who get the needed publicity, funded birth control services and support. Okay, so please be familiar with that. Then I always suggest at the end, please do take a look at the Remember This section, because this is a nice summary of the chapter. Okay, so this chapter is understanding family function versus family structure, understanding what it takes to put together a family visit. Okay. Okay, having a look at your introduction to primary, secondary, and tertiary. Okay, just going back to the objectives here. Okay, family functions and structure. Okay, so going through this chapter, this is what you need to understand, or this is what you need to be able to articulate. Okay, let's move into the next chapter, 21, which is family health risks. Okay, again, let's look at our objectives. Okay, after reading this chapter, you should be able to do the following 6. Okay, so let's go through this chapter and find out and look at what we need to have knowledge about to be able to articulate the objectives. Okay, Healthy People 2030 in this chapter is related to housing and homes and promoting healthy and safe home environments. So you can look at their 6 objectives. Okay, so what are the concepts of family health risk? Okay, the concepts first is the health risks, right? Several factors contribute to the development or healthy or unhealthy outcomes. Okay, we have to be able to perform, again, think ADPI, a health risk appraisal, right? That's the assessment. Okay, we're assessing for specific factors that have been identified that put the family at risk. One of our roles is to try and perform health risk reduction, right? So we are trying to help the family minimize their health risks. Okay. We also work with families in crisis. What is a family crisis defined by? When the family's not able to cope with an event and becomes disorganized and dysfunctional. Okay, all of these are potential scenarios you're going to be working with families in the community. Okay. One of the ways we do family assessments is with genograms. We talk about genograms and ecomaps. Okay, we assess the family in 3 different ways. Okay, the first is biological, the second is environmental, and the third is behavioral. Within this biological health risk assessment, it's called a genogram, where we essentially do research. The family does research on the last 3 generations of family members that have been ill or have died of what different diseases or conditions that we can say put the current family members at risk. For example, if you have a history of stroke in your family, you have a history of cancer in your family, by going back 3 generations and developing, this is what a genogram looks like right here, we can identify patterns of risks. Okay, so that's your biological health assessment. That's your genogram. Okay, the second is your environmental risk. This is considered your ecomap. Okay, so we have to know the difference between the 2 of them. What is an ecomap? Okay, so an ecomap is part of the environmental risk assessment. The genogram was part of the biological risk assessment. Okay, so this is essentially what the family's interactions are with other groups and organizations Okay, what is their relationship to society? Okay, so for example, this is what a ecomap looks like. You have the family in the middle, and then all these little circles on the outside are their interactions with the community. Okay, uh, work, recreation, friends. You can look at all their different relationships. Okay, are they active or are they not active in the community? So that's a good indicator of environmental. Um, your ecomap is a good indicator on how families function within the society. And then the third way we assess is the behavioral, which is the lifestyle risks, right? We know that personal health habits continue to contribute to major causes of morbidity and mortality, right? So patterns of personal health are described as behavioral risks, and they're defined either by the individual or the family. Okay. What are some nursing approaches? What are some of our approaches if we're in the community to contribute to helping the families with risk reduction? Okay. One of the approaches is home visits. Okay. And in table 21.2, there is the phases and activities of a home visit. These are important to know. Okay. The initiation phase, pre-visit phase, in-home phase, termination and post-visit. Okay, you're going to get asked about this. You're going to be given a scenario and asked which phase of the home visit is this activity in. So that's why I have that highlighted. Please understand, please know what these 5 different phases are. Okay. And then it goes through and describes each phase. I think it's perfectly fine if you have an understanding of what the phase is and some of the activities are in each phase. Okay. So one of the important things when we're working with families, it's called contracting, which is setting up a mutual agreement with the family to do the visits. Okay. And again, in the phases in activities and contracting are spelled out here in table 21.3. We have a beginning phase. Okay. Think of your nursing process here as well. Beginning phase, working phase, and termination phase. Okay, you'll also get asked about this and given a scenario and asking which phase of contracting is this activity part of. Okay. Then your levels of prevention in this chapter are strategies prevention related to families. Right, so primary prevention, complete a family genogram and assess health risks within the family. Secondary, maybe use a behavioral health risk survey to identify the factors leading to the health problems. And then tertiary, they already have the problem. So we are developing a contract with the family to try and reduce further complications. Okay. And then please go through the remember this section for the summary of the chapter. The next chapter we're covering is chapter 22. Okay, which is health risks across the lifespan. Remember, we said in community health nursing, you are working with clients across the entire lifespan. So there's issues and risks for all age groups. This is where we talk about that. So please have a look at your objectives. Okay. So we know that in this chapter, we talk about the health status of individuals across the lifespan, and we talk about nursing interventions for these particular groups. Emphasis is on health status, leading causes of death and disease, health risks of children and adolescents, and adults and older adults. Okay. So we know that children's health is very big focus and a major public health issue. We know that the health and the well-being of our kids have a significant impact on the future of the country, right? So some of the things we think about when we think of what is effective healthcare for kids, think about immunizations, dental care, health education. We know that kids with insurance, whether public or private, are more likely to receive better access than care and health care than children without insurance. Okay. Physical, cognitive, emotional changes are occurring rapidly during childhood and adolescence than any other time in their lifespan. So access to regular health is critical. Okay. So when we do our nursing assessments, when we are working with children, right, we are evaluation of growth, development, health status, quality of parent-child relationship, and family support systems. All that is part of assessing the child's health. Some of the common issues with kids, we have obesity. Okay, I highlighted box 22.1 because I wanted to, teaching, health education and teaching is a very big part of what we do in community nursing, and obesity is a huge issue. So I wanted you to review what are some, as we're teaching, what are some family recommendations for obesity prevention? So this is a primary intervention. So please have a look at this box. Injuries and accidents is huge with kids, right? We know that injury and accidents are the most common cause of preventable diseases, disability, and death among kids. Unintentional injuries are injuries that are sustained by accident, such, for example, falls, fires, drowning, suffocation, poison, motor vehicle accidents. We know that most injuries are predictable and preventable. Okay. The key is education and prevention. Okay. So here's some developmental considerations. I'd like for you to read through these. We know that infants have the second highest injury rate of all kids. Okay. Toddlers and preschoolers. This population experiences large and non-fatal falls and being struck by or against an object. School-age children, they have the lowest injury death rate. Okay, but what is common with them? Bicycle accidents. Okay, so what we try and teach and educate them on with regards to bike accidents in the school-age children is the helmets. And then your adolescents, motor vehicle accidents are the leading cause of morbidity and mortality with this group. We know that nurses play a role in prevention of accidents and injuries. Nurses can identify risk factors by assessing the characteristics of the child, the family, and the environment. Okay. Box 22.2 reviews some injury prevention topics, which addresses all of the age groups we just discussed above. One of the other issues is child abuse and neglect. Okay, that's part of our assessment for kids. Mental health issues, behavioral problems, attention issues, sleep issues, anxiety, autism, depression, bipolar, lots of those. We have to be prepared to do not only a physical assessment, but a mental health assessment. And that also includes the assessment for child abuse. Also, acute illness. Okay, we're assessing acute illness all the time in the community. One of the things we're assessing for is SIDS. Okay, SIDS is defined as a sudden death of an infant younger than 1. Chronic health conditions are a big part of our assessment in the community. Okay, and these are chronic health conditions with kids. Okay. Chronic conditions such as asthma is on the rise in kids. So what are some of the targeted areas for prevention with kids? In addition to the prevention of acute illness, we also need to talk about areas such as smoking, nutrition, immunizations, and environmental health. Okay, these are all targets of prevention. Okay, I'd like for you to read through each of these factors, but we know that secondhand smoke to kids is a huge problem, especially with the huge increases in asthma, right? We need to help children have good, healthy dietary habits, right? It's reported that the first 6 years are the most important for developing sound lifetime eating habits. Immunizations, right? We know that routine immunizations is the most successful intervention in preventing some diseases. Okay, and then we need to be able to know how to do an environmental health hazard or an environmental health risk. Okay, the quality of the environment directly affects the health of our kids. So have a look at that section. And then we certainly know that health policy, legislation, and ethics, we're switching gears here with regards to adult health in the older adults. So we're switching gears here for a second. There's 5 pieces of legislation that I'd like for you to be familiar with. And this legislation is regarding the health of adults in the communities they live in. So the 5 of them are the Older Americans Act, and you can read about each one of them. I've highlighted that. That provides social service needs to older people. And then the American with Disabilities Act, we know what that is, providing protection against discrimination. The Patient Self-Determination Act is the right of the older adult to make decisions about their care if they are able. Okay. So please have an idea of what these are. I've highlighted them up here. Older Americans, ADA, and then your FMLA, which your FMLA, that is protecting your job to if you have to leave for a short period and take care of a family member. Okay. And then this chapter also discusses what are some of the ethical and legal issues when you're caring for older adults. Okay, elder abuse is a huge issue in the community. And then this section talks about some major health issues and chronic disease management of adults across the lifespan. Okay, as people are living longer, there are more chronic diseases. Okay, so we as community nurses are working with this population of how to manage their chronic diseases. We know the chronic disease, there's no cure, right? So our focus as nurses is more on the holistic, helping them maintain their independence and helping them through psychosocial issues. Okay. And then it goes through, there's your healthy people. And this chapter, it's related to objectives relevant to major health issues in adults and youth. Okay, some of the chronic diseases we're working with in our older population are cardiovascular disease, hypertension, stroke, diabetes, mental illness, cancer, weight control. Then there's also a section that describes women's health concerns. What are some primary women's health concerns? Eating disorders, reproductive health, gestational diabetes during pregnancy, menopause, breast cancer, osteoporosis, men's health concerns. They're not identified as specifically as the women's because we know that men don't typically participate in healthcare at the same level as women do. Okay, but they do talk about cancers unique to men, erectile dysfunction. Okay. And then we also have health disparities among special groups. What's a health disparity? Okay. Health inequities or disparities are often due to the unequal distribution of power and resources. So what groups have been recognized as experiencing health disparities have become a priority. Okay. We know that poverty is a strong underlying current throughout all the special groups. Okay, so some of these special groups that experience health disparities are adults of color, incarcerated adults, LGBTQ community, adults with physical and mental health disabilities. The frail elderly are also a targeted group. Okay. So the last part of this chapter is what are some community-based models for care of the adults? So I'd like you to be familiar with different kinds of community settings and what their goal is. So we have senior centers, we have adult health, home health and hospice, assisted living, long-term care, and rehabilitation. Those are the different community care settings in which this population is cared for. Okay. So again, go to the remember this, review the important bullets of the chapter here. And then the last chapter we're going to cover is school nursing, which is my expertise. I just retired from the schools after 20 years. Loved it. Big part of community nursing. So again, review your objectives. I've reviewed your objectives for all the objectives for all the chapter, and then went through the chapter and tried to pinpoint the important areas. Okay, we know that school nursing is a specialty in which we're trying to provide health care and illness prevention to the school-age child, right? We participate in education for both the students and the staff. Okay. These are some, table 31.2 is important to review. This is this is ongoing federal legislation that's affected school nurses and the school nursing profession. Okay. Starts all the way back to 1954. And then we have the 504. Okay, please read the effect on school nurses. So 504 is big. Children cannot be excluded because of their handicap. Okay, school must provide health services that each child needs, whether it's extended academic support, PT, OT, speech. Okay, and then the education for all handicapped. All children should attend in the least restricted environment. And then you're in 92, the can't discriminate against people with disabilities. Okay. The WIC program was active 2004, right? So this is important, every local agency that's participating in this particular federal meal program must establish a school wellness policy. Okay. Standards of practice for school nurses. Ours is the National Association for School Nurses. That is the professional organization that we look to for all of our guidelines. And here's how they guide us. Okay, what are some roles of the school nurses? Functions of the school nurses? Well, we can function as direct caregivers. We are health educators, case managers, consultants, counselors. We do lots of community outreach. and lots of research. Okay. Healthy People 2030 has a significant number of objectives related to school nursing. So please have a look at those. And here's the big introduction to primary, secondary, and tertiary. Okay, there's 3 levels of prevention. Okay, we're talking about this in the school setting for now. Okay, primary, secondary, and tertiary has always been part of healthcare in the schools. So as a summary, I highlighted for you, primary prevention provides health promotion and education to prevent problems. Okay, P, primary, has to do with prevention. Secondary includes screening of children for various diseases, monitoring their growth and development, or caring for them when they're injured. Okay, so secondary S is screening. And then tertiary in the schools is the providing the care to children who have long-term health needs, along with education within the school community. Okay, so here's a nice little visual of primary, secondary, and tertiary. Figure it's 31.2. And then it goes through, I would suggest you read these sections. It goes through in much greater detail. Primary, they're pretty long sections, but I think you would have give you a very good understanding of primary, secondary, and tertiary. Okay. And then secondary, did I miss that? No, primary was a long section in this book. I missed a bunch of it, so let me go back here. Sorry about that. Okay. School health services, we talked about that. Healthy people, primary, secondary, tertiary. So here's your primary prevention, right? Primary prevention in schools. Preventing childhood injuries. Substance abuse prevention education is another good example of a primary intervention. Disease prevention, vaccinations. And then secondary, move into screening. Screening, assessing and screening children at schools, screening for lice. It's another example. Screening for abuse and neglect. Communicating with healthcare providers. Okay, screening for violence at school or dealing with violence at school. And then tertiary, remember they already have the health issue, the health problem. Okay. So we're providing care related to tertiary when working with children that have long-term or chronic illnesses or have special needs. Right. So the goal, as we've talked about for primary prevention, is to assist the kids in returning to their highest level of function. Okay. So this is a really good section in this particular chapter to have a good understanding of primary, secondary, and tertiary. I know it's related to the school setting, but it can also be applied in the general sense. Okay, so the kinds of children you might be caring for in a tertiary setting would be kids with diabetes, kids with on the ASD, on the autism spectrum, ADHD. You might be dealing with kids that actually need procedures performed at school, such as catheterizations, dressing changes, trach care, trach suctioning, G-tube feedings. Okay. Kids with DNRs in the schools, kids that are homebound, maybe pregnant teenagers, teenage mothers at school. Okay. And I'd like to review this future trends in school nursing, right? School nurses are increasing their scope all the time. The future of school nursing is very strong. The amount of healthcare being given in schools is increasing dramatically, and I saw that over my 20 years, right? So in the future, school nursing may coordinate primary health care and specialist consultants for students in rural areas that have limited access. I think part of the future is telecommunication, telehealth, okay, online resources um, for school nurses. We are using lots of online resources through NASN, the National uh, School Nurses Association. Okay. And remember this. Okay. So that concludes my week 2 content lecture. We can review any of this you have questions with in class. All right. Thanks.